Good evening. We begin the news hour with what is being called the worst treatment scandal in the history of the NHS, a scandal that left nearly 3,000 people dead. A public inquiry has begun in London looking at how thousands of patients were given infected blood products during the 1970s and 80s. Many contracted HIV or hepatitis. It follows decades of controversy and allegations of a huge cover-up at the highest levels. Today, finally, victims' families, survivors and campaigners were getting the chance to have their say about the scandal, and it was emotional testimony.
I was affected by the fact that my husband, Tom, received contaminated blood products in late 60s, 70s.
Graham, he was a severe haemophiliac. And I had to go home to my mother and sit down with Graham and tell him at 15 that he got HIV.
We lost our granddad as a consequence of contracting HIV from the use of blood products. And as a result of that, as a consequence, my nan was secondary infected, who we also lost.
Well, our correspondent Paul Kelso is covering the inquiry. And Paul, some campaigners saying too little, too late. But what are the chances, do you think, of getting to the truth here?
Certainly there is an enormous amount of faith being placed in this inquiry, so long in the making. Some people have been campaigning for 3 decades for this, Mark, and this was a positive start on my assessment for both the inquiry chairman, Sir Brian Langstaff, and the victims who were here today. The death toll from contaminated blood, nearly 3,000 people and counting, dwarfs any other British public scandal since the war. But unlike a Hillsborough or a Grenfell Tower, there is no monument, there is no focal point for this tragedy. Today, for the very first time, those victims had one with that commemorative event we've just heard elements of here, which was the beginning of the inquiry, and a very deliberate attempt by the inquiry to tell the victims that they would be at the heart of this, that the chairman would listen to them. And when Sir Brian Langstaff got to his feet this afternoon to deliver his opening words, it was very clear that his central message was that people who've been affected by this inquiry over 30 years would be the heart of it. But he also made it very clear he's going to take extremely seriously the persistent allegations that there was a cover-up in government, in the Department of Health, by officials, perhaps by politicians, to try and minimise the government exposure, the blame for this inquiry. This is what he told the victims.
I mentioned the allegation of cover-up. You should know that it is not only the law, but a central principle of mine, that this inquiry is independent of government. It is willing to hold people to account where appropriate, and it will express its views at the end without fear or favour, affection or ill will.
So, Paul, what are the chances, do you think, of people being held to account at the end of all this?
Well, he said there he's going to take the allegations seriously. There's plenty of evidence that's already in the public domain. In many ways, this is a scandal that's been hidden in plain view. Since the early 80s, Lord Owen, David Owen, as he was when he was a health minister, has said that he had called for the UK to be self-sufficient in these blood products. It didn't happen, and his papers were destroyed. He told Sky News at the end of last year that he believed that was still the case. We've seen cabinet papers from 1987 in which it appears that a subcommittee discussing the infection of so many people talked about minimising the exposure because the government simply could not say that it didn't have a role. There is a view, backed by what evidence there is in the public domain so far, that the medical profession, elements of the pharmaceutical industry and indeed ministers were aware of just how dangerous these contaminated products were, and that not enough was done to prevent them being given out to patients. Now, Sir Brian says he will be able with the powers he has in this inquiry, to get to fresh documents. In fact, he said he had already got to new documents that simply would not have been disclosed, and victims and campaigners are putting a lot of store by that. He also said something rather chilling in terms of those given blood transfusions by the UK authorities, UK blood that simply wasn't screened at all for any illnesses. He said he believed an estimate there could be as many as 25,000 people infected, many of them walking around today not knowing that they have hepatitis C, but yet haven't yet been told that they've got it. He believes that estimate could be accurate. So the number of people affected by this could grow as the inquiry goes on. This could take at least 2 years. And of course, many more people are likely to die while they wait to hear his final recommendations.
All right, Paul, thank you very much indeed. Paul Kelso there on the beginning of this very important public inquiry.